so worried. Oh, God, I found them. I found them. They're over here. Hey. Hey. Look at me. Are you awake? Hey, wake up. Oh my God. They're alive. They're alive, but oh my God, their injuries are so bad. Where's my first aid kit? Better yet, bring my trauma bag. Yeah, bring it. Okay. Okay. Look at me. You're gonna be fine. You just gotta keep your eyes on me, okay? Don't look anywhere else. Okay? Can you hear me? Can you respond to my voice? Okay. Okay, let's get my trauma blanket on him, alright? Yeah. Let's get my trauma blanket on him. You cold? Yeah, it's really chilly out. Who knew you'd be getting into this bad of an accident in the winter? Alright. Alright. Alright, okay. We're gonna get you fixed, okay? Okay. Just look at me and just tell me you're gonna be okay, okay? I want you to repeat after me, okay? I'm gonna be okay. I'm gonna make it home safe. Okay, yes. Your friends are gonna see you again. We're gonna get you all patched up, okay? Alright. Where's my pulse oximeter? Here it is? Okay. Can I just see one of your fingers? Alright, that's just gonna stay on your finger for a second, okay? It's gonna give me a reading, and then after the reading, it's gonna give me all the information I need to know, okay? Alright, just control your breathing. I'm here. We're all going. We're schmoving. Can you tell me about what happened? Yeah. Okay. Okay. We're going. We're moving. Okay. Okay. Their SpO2's 96 and our respirations... No, their beats per minute is 96. Yeah. Alright, someone call 911, get them on the way. Get the ambulance coming. Yeah. Alright. Alright, there's the pulse oximeter, okay. Crap, we gotta bandage that. Can someone get me a gauze pad? Yeah, just, yeah, that'll be fine. Okay. Okay, we're gonna get you going, okay? Everything's gonna be fine. We're gonna keep you here. You're gonna be healthy. You're gonna be fine. We're moving. We're gonna get you home. You're gonna be heading to the hospital. Okay, I have a gauze pad right here. Come on out. Okay, I have a gauze pad. I'm gonna be using this. Okay, I just need you to stand still, okay? I gotta put it in my mouth because I'm so focused on everything else. Okay. I'm just gonna hold that there. Okay, hey, don't look anywhere else. Just look at me, okay? Just keep talking to me and keep telling me you're gonna be home safe, okay? Because that's what you're gonna do. You're gonna be home safe. Alright? Just hold it there. You're gonna be fine. You're gonna be fine. You're going to be fine, and I know you're going to be fine. Yes, okay? You're gonna tell me you're gonna be fine. Okay, can you tell me your name? Okay, that's a really nice name. Can you tell me your age? Alright. Any medical conditions or medications I should know of? Blood thinners, diabetes, anything like that? No? Okay, just stand still. We'll be fine. Ambulances are coming. They're a bit out of the way. But, I'm gonna be here, okay? What? You gotta lay down? Okay, lay down. Let me help you. Let me help you down, okay? You're going from sitting up to laying down. Oh, there you go. Okay. Okay, just keep your eyes on me, okay? just gonna keep that gauze pad right there. Yeah, it's to the side of your head. Is there anywhere else that hurts? Right there? Oh, your arm. Well, fudge nuggets, I might need to splint that then. Does it really hurt? Yes? Okay. Let's splint that, shall we? Okay, I got my splint. It's called a Sam splint. It's a really funny name. Okay, we're just gonna leave this right there. Can you hold your arm close to your chest like if it was in a sling? Yeah, let me grab a sling for you. Okay, I have a triangular bandage right here. Okay, let's get it out. Yeah, here's the triangular bandage. I'm just gonna wove it. Yeah, good. Just hold your arm there. Don't try to move it. Ooh, I know, I must hurt. I'm sorry. What? Oh, Dr. Frostbite. Nice to meet you. Can you tell me anything about the crash? Oh crap, you were thrown through the windshield? Were you wearing your seatbelt? Oh my god. Okay, they're coming. Okay? Just keep talking to me. I'm gonna keep talking to them, okay? Yeah, they're awake. Yeah, they're alert and verbal. They can speak, but they're in a lot of pain. I put on some pressure onto a wound on the side of their head. They're also complaining of pain in the arm, so I put on a Sam splint and I put on a triangular bandage. So that should help. Yeah, I'm sitting with them. Yeah, that was their name. Yeah. Yeah. Any medications or medical conditions I should know about? Yeah, just any. Okay, Goober syndrome, boy kisser's disease. That's all they gave me. Yeah. How long until you guys get here? What? Okay, I get it. There's probably something going on. We're gonna be right here. Yeah. Alright, I'll stay on the phone. I'll pick up the phone and talk to you if anything needs more clarification, okay? Yeah, I'm about to get their blood pressure and I'm about to get their heart sounds. Okay. Yeah. Okay. Hey, so good news. They're coming. They're on their way. They're gonna get here in a second. Well, not really a second, but you know, it's gonna be a second. What I'm gonna do is I'm gonna get your blood pressure and I'm gonna get all the other information they need, okay? We're going, we're moving, we're clear, we're Gucci. Okay. Okay, just, can you get your arm in there? Yeah. Alright, and I'm gonna put it on that kinda tight. I'm sorry if it hurts, but I just have to, I'm sorry. Okay, it's gonna start to squeeze, but don't worry, it's normal. Ready? Just gonna close the valve, and then we're gonna start squeezing. And pumped it up all the way to 160, and then I'm gonna let the air out. Oh god, please. I'm gonna redo this, please. Hopefully it wasn't the same reading. Okay. it's not the best, but you know, I'll let the extra air out. Okay. What? No. Your blood pressure is just pretty low. I'm gonna listen to your heart, okay? I'm gonna get my stethoscope out. And then... No. What? What do you mean, why am I doing all this? It's because I care. I don't care if I don't know you. You're a person. Okay, ready? Breathe in for me. Good. Breathe out. Good, good. Again, breathe in. And breathe out. Good, 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 good. Breathe in. And breathe out. Good. Okay. So you still have... Okay, that's going. We're good. We're Gucci. We're getting going. All right. I'm going to look into your pupils, okay? Can you just open your eyes for me? Okay. All right. Can you just look at the light? I know it's bright. Let's look at it. Okay. I'm going to turn off the light. Look at your eyes. Okay. Okay, look at it again. Okay. You're going. You're moving. You're getting things going. Okay. Okay. We're going. We're gonna get you going, okay? And do the other eye. Yes, good, 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 good. Nice. Okay. Alright. I have an update on them. Their blood pressure is pretty low, but their heart rate is somewhat normal. Yeah, I just took their, I looked at their eyes with a pen light. One of their eyes isn't really, you know, dilating the way it should, but one is. One of them isn't responding. I'm suspecting it could be a concussion. Let me look into the ears and see if there's any, cranial fluid. No, nothing there. Nothing there. No, I don't see any. Yes, I'll stay with them. Okay. How long? Alright, I'll be here. Okay. Okay, let's see. Is there anything else that hurts? They said they'll be, I don't know, about 10 minutes out. Yeah. The important thing is to stay calm. Stay calm is the best thing we can do. Okay, you're kind of bleeding there. Let me grab another gauze pad. Alright, let's get this one open. Alright, let's cover this wound down here. Alright, why were you traveling? Where were you going? What were your plans? Oh, you were going to the... Oh, yeah. Nice, nice. I've actually was planning on going there myself, and then I saw the whole accident. What? No! No, I'm not gonna leave you. No, no. Shut up. I'm not leaving you like this. Because I care. I'm not gonna let you sit here and, you know, hurt. Hey, if it means I can make the smallest difference and give you the slightest chance of, you know, living through this, then I'm gonna take it. Because you matter. You matter to people. There are people, you have friends, you have family, you have people around you who care about you. So I'm gonna do my darnest to make sure that you see them again, and they say you to see you again. No, don't worry about me crying. I'm gonna worry about you, okay? They're gonna be here soon, okay? Okay, just deep. Yes, just breathe deep. Yes. I'm here for you, okay? I'm always gonna be here for you. I'm not gonna leave your side. I'm gonna be right here. No, I'm not leaving you. You're staying right here and you're staying by my side, and that's not changing. You understand me? Yes. Okay, let's get a gauze roll so we can roll this with the gauze pad, okay? Get ready. Okay, ready? Doing good. Going down the arm. And then we're gonna go up the arm. And then I'm gonna hold it in place. Okay, I have some tape here. I'm just gonna tape it off with. There. That should hold it in place for now until they get here, alright? No, I'm not. Stop it. I'm not letting you die. Quit it. You're gonna be fine. You're gonna be fine. This is not a bother at all. This is what I've been wanting to do, is help a person who's in this much pain and who's been through an accident like this. Okay? Everything's gonna be fine. Yeah, they're gonna be here soon. It's gonna be fine, okay? You're gonna breathe through this, you're gonna be fine. Okay, let's get your blood pressure again. Is there anywhere else on your body that hurts, or did I get it all? I got it all? Okay. Let's get your blood pressure again. Alright, ready? Alright. Let's just do over your arm. Get your blood pressure, okay? Here we go. Just stay calm. Stay calm. Okay, good. Just gonna squeeze the air out. Okay, we're gonna try again. Ready? 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9. Okay. Okay. Oh gosh. Just gonna let the air out. Oh, are you still there on the phone? Yeah. Their blood pressure is back. It's about 118/78. Yeah. No, they don't look pale, clammy, sweating, nothing like that. Yeah, I gave them my shock blanket. That should help warm them up. And in case they do fall into shock, they should be fine. Yeah. Okay. Okay. Okay, I just see a few more slight cuts. I'm gonna deal with that. I'm gonna grab out some band-aids. Let me grab out my band-aids. Do you want to pick which band-aids? Yeah, okay. So I have these rainbow ones. I have these really cool art ones were my favorite. The art ones? Okay. Let me grab those. Okay, let's just... Right, 1, 2, 3. I'm just gonna put that right there, okay? That should help with that. And then one more just right down there. Okay. Alright, and that one is gonna go right here. Okay, that should be all the wounds I see. Do I have your permission to lift your shirt and see if there's any signs of internal bleeding? Okay. I'm just gonna... Okay, I don't see any discoloration. I don't see any bruising, as well as I can see. Does anywhere feel tender or sore? Yeah, okay. Let me quickly grab you an ice pack. You're just gonna hold that there. And then you're just gonna hold it there for a second. And then after that, the paramedics should be here in a second. Huh? Hey! They're over here! Hey! Oh my god. Hey, you're alright. You're alright. Hey, you're at the hospital. Honestly, I'm happy you survived. Your car, I'm sorry, it's totaled. Yeah, they said it would not be able to run again. They called a tow truck for it. Look, don't worry about your car right now. You gotta worry about yourself. Look at you. You're alive. And if anything, I'm proud of that. Mainly because that, from the accident, it looked like you wouldn't, but you did. And that's because you have a reason. No, it's not that. It's because that you still have people left in this world to help and to make happy. Hey, no. I'm gonna tell you again, and I'm gonna tell you what the exact same thing I said back there on the road. I am not gonna leave you to just be out there in the snow. Because you matter to people. You matter to me. I'm not gonna let you be out there in the cold, bleeding out. Look, I know you don't know me, and I don't know you, but that's different, okay? It's because that we have the same mutual care for people. And things may be tough now, and you may not think so, but I know so. Because you make people happy. You've made me happy. Trusting me to care for you out there. Yes. Yeah, I understand. You were traveling alone. Didn't see anyone else in the car. If anything, I'm glad no one else was in the car. Would have been and became an MCI, and there would have only been one me, and I hate having to choose who to care for at an MCI, but you were the only patient I could see, so I just jumped in and helped. Look, it's not that. It's mainly because What? Yeah, don't worry about that. That's not to be worried about right now. Just worry about your health, okay? Oh, you were out, let's see. You were out for a little over 3 hours. Yeah, you had no one else to go with you, so I was like, I have really nowhere else to go. So I hopped in the ambulance. What do you mean? I don't care about that anymore. Where I was going doesn't matter. What matters is you. No, it wasn't a waste of time for me to help you. Don't you don't you dare say that. It was not a waste. I wanted to because you mattered to people and you mattered to me. So I did what I had to. Yes. Look. I didn't want to leave you alone going to the hospital because even though I work in one, I know how scary it can be being in a hospital alone, and it sucks. It quite frankly sucks, and I'm gonna be completely blatantly blunt with you. It sucks. Scary BB monitors, doctors traveling up and down the hallways, and constant anxiety about your condition. Yeah, I knew it was hard. Can't imagine the pain you were in the wreck. Had to dig you out a few pieces of metal off top of you. Yeah. The doctor said you should make a full recovery in less than a few weeks, so that's good, right? Yeah. Well, let me look at the time. Oh, crap. Visitation times are almost over. I'll have to come see you another time, okay? I could stay the night, but I have things I need to attend to, okay? But hey, I'll make you this deal. How about tomorrow, after my shift in the ER, I will bring you a treat. Of course, if the doctors allow it. Yeah, of course. Alright. You should get some rest, okay? Those wounds won't heal themselves. Yeah. Okay. I'll see you later.